no more ado, I'm just going to very informally just say it's Nick and Dee, and over to you two to introduce yourselves and tell us about the contents of these bowls.
Okie dokie. My name is Nick Hayes, and this is my colleague Dr. Dean Willis. We both work in what was the pharmacology department at University College and is now part of the research division of neuroscience, physiology and pharmacology. We're both scientists. As scientists, we like, well, shall I say facts, but anyway, as scientists, what I would like to introduce you to is the concept of a dose-response curve, the dose in this case being heat, the response in this case being perceived heat or possibly pain. What I have here, because we're scientists, we have a control experiment, which is popcorn, pure and simple. We have a doctored set of popcorn. This one is doctored with this pepper, which is a jalapeno pepper. And this, Dean will talk about a bit later on, this is the Scoville scale. It gives you some idea of the heat of peppers. So if we look at the top, pure capsaicin, which is what gives us the heat, is up to 16 million on the Scoville scale. This guy is 2,500 to 8,000 on the Scoville scale. So I'm going to pass these around. I'm also going to pass around some napkins. So if you feel the need to spit, then you have something to spit into. So I'll start with you. So controlled experiment first. You just pass it on, I think it's going to be the way to do this. I should say that it takes a little bit of time for the heat to come through. So if you're not getting anything, don't start gobbling it away, because you might find you've got a little more than you want. So this is our first one. This is the jalapeno. The second one is Thai bird-eye chili pepper. That's a little bit more hotter. It's 50,000 to 100,000. So compared to jalapeno, 6-7 times hotter. What I've done with these, I should say, is I've chopped the chilies up, marinated them in the oil that I cooked the popcorn in overnight. So these are about 10 hours of cold extraction, if you like. So I'm not sure myself how hot everything is.
They are hot.
I can assure you that when I was doing these this morning in the kitchen, though, I had to get out a couple of times. So there is some heat in there. Finally, the third one I'm going to give you is the Scotch bonnet, 100,000 to 350,000. So we expect it to be 10, 12 times hotter than perhaps the first one. So, over to Dee.
Okay.
I'll warn you the science.
So, thank you for inviting us anyway today. I'm going to talk about spicy foods and basically some of the science behind them. And I think these represent some, for this symposium in particular, some very important ideas about how we can look at foods, look at some of their physiological actions, and eventually develop drugs which can have significant clinical efficacy. Indeed, many cultures around the world have actually been intrigued by the physiological and medicinal properties of spicy foods for literally millennia. And it's therefore not surprising that some of the first basic chemistry and pharmacology carried out in the early part of the 19th century was conducted in which people, individual scientists, chemists were looking at the active components of spicy foods. So, where do I start? Well, we start off with surgery. This is a description of a surgical procedure carried out in the early part of the 18th century. The operation is performed in this manner. White ligatures or bandages are bound tightly around the lower part of the belly and the upper part of the thighs to prevent too much hemorrhage. Good, nice clinical procedure there. The parts about to be operated on are then bathed 3 times in hot pepper water. When the parts have been sufficiently bathed, the whole, both testicles and penises, are cut off as closely as possible with a small curved knife in the shape of a sickle. The individual is then inserted with a pewter needle or spigot thrust into the orifice remaining. The penis is then bound and saturated with paper soaked in cold water. After the wound has been dressed, the patient is made to walk about the room supported by the 2 of the knifers for 2 to 3 hours. He is then allowed to lie down. This is one of the first uses behind spicy foods, their local anaesthetic effects. Indeed, during the preparation, during the surgery to drive a eunuch, hot spicy peppers were used to basically anaesthetise the area to be removed. There's some debate actually on whether they're used pre-operative or post-operative. A Russian physician noted that actually the wound was bathed in pepper water after the operation. In this context, the operator would talk to the potential patient, ask him if he was prepared to become a eunuch. Obviously, this individual would say yes, he was. At which point, there'd be some diversion. Have a look over there, it's the emperor. At which point, the operator would grab the patient's testicles, do a rotation, therefore cutting off a blood supply, and in one action, remove the testicles. At this point, the wound would then be bathed in spicy, hot water, therefore suggesting that it has some kind of antibacterial, anti-infectious properties. Now, if you look at the literature, there's a variety of texts in which Westerners have looked at this scientific procedure. In fact, in medicine, in Western medicine, the eunuchs have been a great source of interest and those publications. The last clinical observations of eunuchs was by this gentleman, McFadden, in Hong Kong. And he wrote a paper in British Journal of Medicine in which he talked about a eunuch getting gout. This is quite unusual because it was thought that eunuchs don't get gout because they had a very pious lifestyle, not taking alcohol or meat products. It was also reported this gentleman was extremely angry all the time during the clinical investigation, which is not surprised. He was a eunuch and he had gout. Gout can be extremely painful. So what are we talking about here? We're talking about basically two geneses. We have the capsicum and the piper. The hot chili peppers come from South America. These were brought into Europe by the Portuguese and Spanish explorers in about the 14th to 15th century. The black peppers come from China and India, and these have been in Europe a lot longer, approximately from the time of about 100 BC to 50 AD. Indeed, Romans used a lot of black peppers in their cooking, in fact in everything, in their foods, in their wines. And they basically saturated their foods with different black peppers.